Urgent alert. What they're not telling you about colonoscopies. Protect yourself today. Imagine discovering too late that a routine, largely painless procedure could have prevented a life-threatening disease. Did you know that colorectal cancer is the second leading cause of cancer-related deaths worldwide? Here's the devastating part. A large proportion of these could have been avoided through early detection, particularly with colonoscopies. How would you feel if one simple decision, a procedure that typically takes only a few hours, could potentially spare you or a loved one years of invasive treatment, emotional distress, or even the heartbreak of a terminal diagnosis? The reality is that colorectal cancer often grows quietly, making it all the more critical to understand why colonoscopies aren't just for older adults anymore. Younger people are increasingly at risk, and many remain unaware until it's too late. Today, you'll learn 10 critical facts about colonoscopies that rarely get discussed. These insights could genuinely be a lifesaver. And what's truly surprising? Sometimes, it's the smallest detail, like the timing of your screening or the thoroughness of your prep, that can determine whether you catch a precancerous polyp early or miss it altogether. Below are 10 in-depth points that will give you a comprehensive, detailed understanding of why colonoscopies matter so much, how to maximize their effectiveness, and what concrete steps you can take to protect yourself and your loved ones. 1. The danger of putting off the exam. Description. Many people still assume, I'll worry about a colonoscopy at 50, or wait for obvious symptoms like rectal bleeding or sharp abdominal pain. The truth is, colorectal cancer often remains silent for years. Polyps, small growths in the colon or rectum, can slowly develop without causing noticeable problems. By the time you see blood or suffer pain, the polyp may have advanced significantly or even become malignant. Recent studies indicate a steady rise in early-onset colorectal cancer, with diagnoses occurring in individuals even in their mid-30s. This upward trend has led many medical organizations to revise their guidelines, advising people to consider starting screening at age 45 or earlier if they have risk factors. Prolonged denial or the belief that I'm too young can be dangerous. Even symptom-free individuals can harbor precancerous growths. Additional details. Doctors often emphasize that not all polyp growths produce warning signs like intense pain or dramatic changes in bowel habits. Some patients only experience mild intermittent symptoms, fatigue, low-grade cramps, or slight weight loss that are easy to dismiss. By the time these signs become urgent, a once manageable polyp may have turned into something far more serious. Curiosity and example. Take Jason, 42, who lived a healthy lifestyle. He ran marathons, ate well, and never suspected he could be at risk. After 2 months of on and off rectal bleeding, he finally scheduled a colonoscopy. Doctors found multiple polyps, some with high-grade dysplasia. Caught just in time, they removed them before they progressed to full-blown cancer. Had Jason waited another year or two, his prognosis might have been very different. Recommended action. Don't rely on age alone. If you experience any unusual GI symptoms, see a specialist immediately. Stay current with guidelines. They may have changed from what you heard a decade ago. Promptly address minor issues like chronic fatigue, mild bleeding, or persistent cramps. Early discovery can make a life-saving difference. 2. Colonoscopy as both diagnostic and preventive. Description. Where many medical tests only confirm the presence of disease, colonoscopies shine because they can prevent cancer from arising in the first place. A colonoscopy allows doctors to examine the colon's lining in real time and, crucially, remove polyps on the spot, often before they have a chance to turn malignant. Polyps can take years to develop, creating a valuable window for intervention. This see and treat approach is unique and markedly reduces the future risk of colorectal cancer. Additional details. What makes this so powerful is the direct and immediate action. You enter the procedure with potential or early-stage abnormalities, and if polyps are detected, they're frequently removed during the same session. No follow-up surgery, no delayed testing. It's efficient and proactive. This is a stark contrast to stool-based tests, for example. where an abnormal result only indicates you need another procedure to remove any suspicious growths. Curiosity and example. Studies indicate that regular colonoscopies can lower colon cancer mortality by up to 60%. Dr. A. Lindstrom, a leading gastroenterologist, notes that many of her patients avoid more invasive treatments down the road because she removed concerning polyps early. It's almost like getting your car serviced regularly, except here, we're preventing a potentially fatal disease instead of a breakdown, she says. Recommended action. Embrace the mindset that colonoscopy isn't just detection, but prevention. Educate family members who may be hesitant or think they only need this if they already have symptoms. Stick to follow-up intervals. Removing polyps once doesn't guarantee new ones won't appear later. 3. The critical importance of proper bowel preparation. Description. Everyone dreads the bowel prep. Drinking that potent laxative and sticking to a clear liquid diet. It's not glamorous, but it's absolutely vital. Any residue in the colon can hide small polyps or lesions, potentially letting them slip by undetected. Inadequate prep is one of the top reasons lesions get overlooked, which can lead to a false sense of security. If your colon isn't clean, your doctor may also advise you to repeat the colonoscopy sooner, meaning extra cost, discomfort, and time off work. Additional details. Different prep methods exist now, including split-dose regimens, which can make the process more tolerable. Some preps even come in flavored variations, and doctors may recommend taking them with certain clear liquids to mask the taste. The key is to follow the instructions exactly. Cutting corners on the prep can jeopardize the entire exam. Curiosity and example. A 2019 study showed that up to 20% of colonoscopies are deemed suboptimal due to poor bowel prep. One patient admitted she thought skipping the last dose of the prep liquid wouldn't matter. Her doctor ended up finding her colon only partially clean and missed visualizing parts of the colon wall, increasing the risk of missing hidden lesions. Recommended action. Ask your doctor for clarity on the best prep method for you, split dose, different flavor options, etc. Begin the prep at the recommended time. Don't wait too late or start too early. Stay hydrated with electrolyte solutions and approved clear liquids to prevent dehydration and help flush out the system. For sedation and comfort, overcoming the fear. Description. One of the biggest barriers to getting a colonoscopy is the fear of pain or discomfort. However, modern colonoscopy techniques typically involve light sedation or conscious sedation, ensuring patients experience minimal, if any, pain. Patients often describe the procedure as a brief nap, waking up with only slight grogginess. Recovery is quick for most. You'll be monitored post-procedure to ensure you're stable before heading home. Additional details. There are various sedation options. Some clinics use propofol for a deeper but still short-acting sedation, while others might use a combination of milder sedatives and analgesics. The key is that you shouldn't feel anything beyond mild pressure or bloating. If you have any special medical conditions, always inform your medical team so they can adjust sedation accordingly. Curiosity and example. Danielle, who put off her colonoscopy for years, was surprised at how smooth it went. The worst part wasn't the exam. It was the night before, she joked. Afterward, she rested for about 30 minutes at the clinic and felt fine enough for a light meal later that day. Recommended action. Talk to your doctor if you're especially anxious. They can walk you through sedation details. Be transparent about any allergies or past anesthesia experiences to tailor the safest plan. Plan a ride home. Even if you feel well, it's unsafe to drive right after sedation. 5. Updated screening guidelines and their rationale. Description. It was once standard to begin colonoscopies at age 50 for average-risk adults, but spiking rates of early-onset colorectal cancer pushed many health organizations, like the U.S. Preventive Services Task Force, to lower the recommended age to 45. Some individuals with significant risk factors start even earlier. Shifting lifestyle habits, increased processed foods, sedentary routines, are partly blamed for the uptick in younger cases. Your personal risk profile, Family history, obesity, smoking may lower your recommended screening age below 45. Additional details. Healthcare professionals emphasize that this age adjustment isn't arbitrary. It reflects robust epidemiological data, pointing to worrying trends in colon cancer. Moreover, younger patients sometimes present with more aggressive tumor biology, meaning a delayed diagnosis can have severe consequences. Curiosity and example. A 2021 study showed people born in the 1990s had double the risk of colon cancer compared to those born in the 1950s at the same age. This illustrates how external factors, diet, environment, or even shifts in gut microbiome may be accelerating the onset of disease. Recommended action. Check your risk profile. If you're nearing 45 or have concerns, talk to a doctor about getting screened sooner. Don't assume old guidelines still apply. Advice changes as new data emerges. Spread the word. Many people in their 40s may still think colonoscopies are decades away, putting them at risk. 6. Family history. When to start even earlier. Description. If you have a family history of colon cancer or advanced polyps, your risk multiplies. Genetic conditions like Lynch syndrome or familial adenomatous polyposis, FAP, can drive cancer onset at alarmingly young ages, sometimes in the 20s or 30s. Even without a known genetic syndrome, a parent or sibling with early colon cancer often means you should start screening 10 years before the age at which they were diagnosed. Some doctors recommend starting screenings in your 30s if there's a family pattern, even if official guidelines say 45. More frequent follow-up colonoscopies might also be necessary, every 3 to 5 years instead of the usual 10. Additional details. A thorough family medical history can reveal hidden connections. Maybe an aunt or grandfather had colon polyps or GI problems. This background can shift your screening plan drastically. Doctors may also suggest genetic counseling to test for specific hereditary conditions if multiple close relatives had colon cancer. Curiosity and example. Leah learned her grandmother died from colon cancer at 54, and her father had polyps removed at 48. During her screening at 37, 2 suspicious polyps were discovered. While not yet cancerous, they were on a dangerous trajectory. Early detection spared Leah a far more devastating outcome. Recommended action. Gather detailed family history. Ask relatives about any GI cancers or polyp diagnoses. Share all details with your doctor to craft a personalized plan. Don't dismiss second-degree relatives. A pattern of GI issues on one side of the family can still be significant. 7. Lifestyle factors that affect your colon health. Description. Genetics and age aren't the only players in colon health. Lifestyle factors, including diet, weight, physical activity, and smoking, play significant roles in polyp formation and cancer development. Processed meats, high saturated fats, and low fiber can increase your risk, while regular exercise and a diet rich in fruits and vegetables tend to be protective. Obesity, especially abdominal obesity, is linked to insulin resistance, which correlates with higher colon polyp occurrence. Excessive alcohol use also elevates the risk of GI cancers. Additional details. Recently, there's growing interest in the gut microbiome, the bacteria living in your digestive tract. Diets high in refined sugars and processed foods can upset the microbiome's balance, potentially promoting inflammation and polyp growth. Conversely, a fiber-rich diet supports healthy gut flora, which may lower cancer risk. Curiosity and example. A major study found that participants who followed a Mediterranean diet, featuring olive oil, fish, whole grains, and lots of produce, had 30% fewer advanced polyps. Another large-scale analysis reported that smokers not only had a higher likelihood of developing colon cancer, but tended to get it at an earlier age. Recommended action. Gradually shift your diet to include more whole grains, legumes, fruits, and vegetables. Aim for at least 150 minutes of moderate exercise weekly. Walking, cycling, or swimming all help. Limit alcohol and quit smoking. These are potent risk factors you can control. 8. advanced technologies, and techniques. Description: colonoscopy methods have evolved rapidly. High-definition scopes, AI-assisted polyp detection, and dye-spraying chromoendoscopy can highlight tricky lesions. Such innovations enhance the accuracy of the procedure, making it more likely that tiny or flat polyps, often easy to miss, will be spotted. Virtual colonoscopy, CT colonography, exists, but you can't remove polyps during a CT scan. So if something looks suspicious, you'd still need a traditional colonoscopy. For complex or larger polyps, techniques like endoscopic mucosal resection, EMR, or endoscopic submucosal dissection, ESD, let doctors remove them without full-blown surgery. Additional details: AI-assisted systems use real-time video analysis to spot subtle abnormalities that a human eye might overlook, especially small, flat lesions. Some studies suggest these technologies can boost polyp detection rates by 10 to 15%. For patients, that translates into fewer missed growths and a lower chance of discovering advanced cancer later. Curiosity and example: in certain centers, patients with a history of difficult-to-remove polyps are directed to specialized gastroenterologists trained in EMR or ESD, preventing the need for a separate surgical procedure. This can significantly reduce recovery time, hospital stays, and costs. Recommended action: ask your provider what technology they use. Some places may offer advanced or AI-based methods. Inquire about polyp removal expertise if you've had polyps before or a high risk for them. Stay updated. Technology is constantly evolving, so new, more accurate screening methods could emerge in the near future. 9. Balancing the procedure's risks versus the risk of not doing it. Description: no medical procedure is 100% risk-free. Potential colonoscopy complications include bleeding, perforation of the colon, or anesthesia-related issues. However, these incidents are rare, often less than 1%. In contrast, the lifetime risk of developing colorectal cancer is significantly higher, around 1 in 23 for men and 1 in 25 for women. The vast majority of colonoscopies conclude without complications, providing valuable peace of mind. When weighed against the possibility of undiagnosed, progressing cancer, the benefit of screening is substantial. Additional details: perforations are more common if you already have inflammatory bowel disease or if you need removal of large, deeply embedded polyps. Bleeding typically occurs when polyps are removed, but it's usually controlled during the procedure and rarely escalates. Your care team will monitor you carefully to manage any such events. Curiosity and example: Dr. Henry Chong, a gastroenterologist with over 2 decades of experience, notes that he's witnessed far more devastating outcomes in patients who delayed screening than serious side effects from the procedure itself. A missed polyp can grow silently for years until it's much harder or impossible to treat, he explains. Recommended action: discuss medical concerns with your doctor if you have chronic conditions like Crohn's. Keep a balanced perspective. The slim chance of complications is typically outweighed by the real, significant risk of undetected polyps. Follow all medical advice pre- and post-procedure to reduce any complications further, such as resting after sedation or taking prescribed meds. 10. Post-colonoscopy, follow-up, frequency, and next steps. Description: having a colonoscopy isn't just a one-and-done event. Depending on your results, like the type and number of polyps found, your family history, and your personal risk factors, your doctor will recommend when to return. It might be 10 years if everything is clear, or as soon as 3 to 5 years if you had high-risk polyps. Failing to follow these intervals can allow new polyps to develop undetected. Consistency is key, especially if you've already had polyps removed. Additional details: patients sometimes feel so relieved after a clear colonoscopy that they forget to schedule a follow-up. However, polyps can regrow, and new ones can appear in different parts of the colon. If your gastroenterologist found numerous or advanced polyps, they'll likely want to keep a closer eye on you. Early rechecks are far less burdensome than dealing with a more advanced issue later on. Curiosity and example: Consider Megan, who had 4 polyps removed in her late 40s. She adhered to her doctor's advice to come back in 3 years, during which 1 new polyp was discovered and removed. Had she waited the usual 10 years, that polyp could have evolved into something far more dangerous, drastically altering her health journey. Recommended action: ask for a clear timeline before leaving the clinic. 3 years, 5 years, 10 years, etc. Mark it on your calendar or in a digital reminder. Life gets busy, and it's easy to lose track of time. Stay proactive. If new symptoms arise before your next scheduled exam, contact your doctor rather than waiting. We've examined 10 crucial angles on why colonoscopies are indispensable. From the stealthy nature of colon polyps to the groundbreaking technologies ensuring better detection. Next, let's tie it all together and emphasize the core reasons you should act now rather than put off what could be a life-saving screening. Conclusion. Recap. In this comprehensive discussion, we delved into 10 vital facts about colonoscopies. The danger of putting off the exam. Colonoscopy as both diagnostic and preventive. The critical importance of proper bowel preparation. Sedation and comfort. Updated screening guidelines and their rationale. Family history and early screening. Lifestyle factors. Advanced technologies and techniques. Balancing procedure risk versus the risk of not doing it. Post-colonoscopy follow-up. Each point underscores a simple truth. Colonoscopies aren't just another test. They're a powerful tool for early detection and prevention that can literally mean the difference between catching a polyp early or facing advanced cancer later. Now that you're equipped with this knowledge, it's time to take action. Share this video with friends or family members who might be underinformed or hesitant. Like and subscribe to Dr. Health for ongoing insights that could protect your well-being. Schedule a colonoscopy if you're at or near the recommended screening age, or earlier if you have risk factors. Waiting can be a costly mistake, because when it comes to colon cancer, early detection isn't just helpful, it's essential. Take control of your health and encourage others to do the same. Your future self and your loved ones will thank you